My name is Tammy Krentz, and I'm doing this interview because I have retinitis pigmentosa. I guess I was about 3 years old and my parents were having a picnic outside, and I believe I ran into a corner of a picnic table, and it was only dusk out, not dark, and I told my mom I couldn't see, so she took me to the eye doctor, and that's how everything got started.
Now, Tammy has a severe retinal degeneration and inherited retinal dystrophy. Retinal dystrophies are a spectrum of diseases where there's accelerated degeneration of the light-sensitive cells of the retina that cause vision loss up to and including blindness.
I lost my license, and that's when it started affecting me. And at that point, my eyes weren't that bad yet. Now it affects me a lot more, like little things like going shopping. Very frustrating. My sister also has it. We've been very fortunate because we should have lost our vision a long time ago. She did some research online, found this genetic treatment, Luxturna. She took it upon herself to call UPMC Vision Institute, and she got the ball rolling.
So Luxturna basically replaces the gene that's glitched, or the bad gene, the bad RPE65, with a normal functioning gene. This gene therapy product is then placed into the eye, specifically into the space just directly underneath the retina, and allows it to target the cells that you want to maintain in the retina, namely the photoreceptor cells and the retinal pigment epithelial cells, or RPE cells.
Well, my husband's like, well, what's there to lose? If you're going to lose your vision, there's no reason not to get it. There's no pain. You feel the stitch for a couple days. A very simple procedure. It's worth it. I mean, it was easy.
So UPMC Vision Institute is very well equipped to handle this type of gene therapy. We've embarked on having our new building within the past year. Our facilities are top-notch with the latest technology. So this is actually a fairly simple thing for us to do and execute here at UPMC. It's not surprising that we were able to carry this out.
My future with all this is to hopefully not lose my vision and see my grandkids.
So Healthy Harrisburg is really a program not only to address access to quality health care, but also physical health care and getting people healthy. We know that in this zip code area, we have some high rates of chronic disease. So this is UPMC's way of addressing health equity and health disparities by taking the programs where people are and really helping individuals, assess and monitor whatever health care conditions they may have. It's not just a fitness program, but we also do education. We also do things around spirituality.
So Healthy Harrisburg allows us to actually introduce the culture to the community. A lot of people are not versed with African dance and drum. They've never even seen it before or heard of it. So this gives the community a great way to get introduced to it, share culture, because we also always tell what rhythm we're doing, why it was performed, what country it comes from. Sometimes we tap into the people who actually were the first people to do it. So we get to share history, we get to share culture, and it's just a great space for us to access the community.
Today we are on the 13th floor of UPMC Western Psychiatric Hospital. This is the Zoe Atrium unit. It is a 14-bed unit designed to care for people who are struggling with depression, anxiety, and trauma.
So I'm hoping when the patients are here that there's something beautiful to look at. We have positive quotes that the staff provided for each room. Art can and does calm people. It can make someone feel more included, and I hope that doing this helps inspire others and reminds people to maybe, help.
I am sure what patients feel when they come into this space is they feel safe. It makes you feel warm and welcome, that you do belong, that you do matter in our world. That's how those patients should feel when they walk in here.
Coming into a psychiatric hospital can be a really intimidating step for a lot of people. Trying to find ways to soften that experience and make it less overwhelming for people is critically important to us. That's why we're so grateful for the partnership we've had with members from the community and the foundation, and with our artists in the community to lighten up the environment. So anything that we can do to make people feel more comfortable and more welcome is really critical.
sincerely thank you all for being here today as we announce our delivery of yet another service to meet the needs of our community, an expanded emergency room.
The patients choose the hospital they want to go to, and I think our EMS partners acknowledge that we have what UPMC Horizon stands for and what we're able to provide. I think we're seeing that with our increased ambulance arrivals over the last several years. But in the end, though, it's the patients choosing to come to see us, and I think that the type of care we provide is the reason the patients choose to come to UPMC.
This $1.5 million investment added over 1,300 square feet of space and 5 more beds to our existing space. This provides greater capacity to offer the most accessible emergency medical care for residents in our Mercer and Lawrence County communities.
It provides us with, the interfacility transports, that really keep EMS alive, and also it gives us a place to take our patients who need our services, you know what I mean? And it gives them quality care too. That's the thing, backed by the UPMC name, that's huge. People trust it.